local communities. Together, we must ensure that local communities have the resources they need to thrive, laying the foundation for every child and family to succeed and reach their full potential. And so without further ado, we'll get started with our briefings. And so I think first up is the co-chair and executive director of Howard County Local Management Board, Ms. Kim.
So actually, it's going to be me, everybody. Good morning. Pam Brown. I'm with the Anne Arundel County Local Management Board, which is the Partnership for Children, Youth and Families. I think Elijah's going to drive our slides, and we're going to do our very best not to kill you with PowerPoint, but to do a short PowerPoint and then leave it open so you can ask us questions and we can move forward in that way. And if I didn't say good morning to both our chairs, Chair Harris and Chair James, good morning, and to the senators and delegates this morning, obviously your work is our work and vice versa. So Elijah, can you share? And while we're figuring that out, let me just give you a brief reminder about local management boards. So as you know, we were created around about 1990. There were 24 of them, and it was very purposeful. We have 24 local managements in every single county and jurisdiction in the state, simply because, and we can go to the next slide, please, Elijah, simply because what the legislators at that time were trying to do was create a reform of the system, understanding that health and human services are so very siloed into different agencies with different visions and missions. There was this notion of we need to bring people together, especially at the local level. And that's what local management boards were expected to do. And here we all are, shows where we are. Just to confuse everybody, we all give ourselves a different name because we don't really like this name, local management boards. So, you know, Elijah is the collaboration council and the partnership and so on. But there we all are. Next slide, please. So we're in statute, have been since 92, part of the Human Services article. A bit sort of wishy-washy language, but what they're really saying is pull together the various constituencies in health and human services at the local level, including residents, to strengthen that decision-making capacity, to look at a plan for how we work locally, and then to lift up that voice so that voice gets all the way to the state with all its differences in all the different counties. And I always feel when I'm talking to delegates and senators, you get our work because you are essentially local. Even though you get together to try and act as a state, you're constantly looking at the needs and the gaps and everything else that's going on in your local jurisdictions. Next slide, please. So here's the Maryland model, which I always talk about. Everybody's bored of me talking about it, but we are the only state in the nation that has this model. That's it. We're it. We have the governor with his vision. The governor gets that vision down to the children's cabinet. The children's cabinet is made up of all the secretaries in health and human services, the budget secretary, and the superintendent of all schools. They then try and take that vision, create some outcomes that governor wants, and we already know what Governor Moore is trying to achieve here. He's trying to achieve a reduction in child poverty and an increase in economic mobility. And I think we can all get behind that, right? Every single one of us can get behind that. So he's relying on his children's cabinet to try and create strategies to make that happen. The Children's Cabinet worked with the Governor's Office for Children, which our legislature very sensibly have most recently recreated, to do the sort of coordination, the research, the managing of the plan, the measurement that will let the governor know that the Children's Cabinet have got together, that they are creating those strategies and they're looking for results. Here's the piece that got added that was, I think, is the most clever. Of course I do. So underneath all that are the local management boards. They are working with the Governor's Office for Children and the Children's Cabinet to try to almost translate that vision, those strategies, and the need to measure them at the local level. So then we become this sort of convener, this neutral convener for all the local voices that need to weigh in. we do the needs assessment, we figure out where the gaps are, and we collect data. And all of that information gets driven straight back up through the Governor's Office for Children, to the Children's Cabinet, to the Governor. That's how the Maryland model works. We recreated it with when Governor Moore came into office. That model was recreated. I, for one, think that model should be a national model and actually an international model. Next slide, please. So we've had a lot of successes since the 1990s. This was one of probably the most early ones. We were challenged by the then governor to bring Maryland children home. And it was such a lovely thing to be part of, because what we were trying to do, there was so many children who were placed out of state because we had run out of foster care. And the legislature said, through the Children's Cabinet, we got to bring them home. For a start off, it's really, really bad for children to be out of state from their own personal and their family's point of view, but it's also incredibly costly. And they said to local management boards, here's some money, figure it out and report. And we actually brought that number over the years down from 800 to 200 by creating a whole load of programs specifically designed, all evidence-based. I'm looking at them, they're all evidence-based, to bring our kids home. And we did and that was one of the very early successes. Next slide, please. So what do we really do? Well, as I said, we pull those stakeholders together. I'm just the staff person. I'm not my board. My board is made up of residents. They are made up of all the people who are required to serve, like the county director for social services, for mental health, the health officer, the superintendent of schools. But I think what makes it more important is the residents that the county executive appoints, that really tries to bring both a real flavor of everybody to the board, but also almost make it a bipartisan relationship. And I think that's what we bring to the table. And so we're really there to follow the governor's vision, work with the Children's Cabinet, create a community plan, figure out allocation of resources, try to work on the big issues. You know what they are: childcare, transportation, affordable housing. We're never going to make change if we don't fix those things. But at the local level, how are those needs playing out in a county like ours that has got no transportation, where affordable housing is a dream? How does that play out in Anne Arundel County? And what can I do with all of my folk in Anne Arundel County to make a difference? So that's sort of how the system works. We are constantly applying for grants other than what we get from the Governor's Office for Children through the Interagency Fund. And I'll talk about, one of us will talk about that a little bit more. But it's that notion of, how do you work locally? How do we explain things to our local legislators? How do we try in each jurisdiction to move childhood poverty, to move economic mobility, given what's happening locally? And now I believe I'm handing over to you, right, Elijah?
That's
You're going to
right.
talk about the successes, right?
Yeah, I've got it covered. Good morning, everyone. Good to be here with you all again, echoing my colleague Pam's statement earlier. Appreciate the chairs, Delegate Harris, Senator James, for having us here with you all this morning. My name is Elijah Wheeler. I have the pleasure of serving as the Executive Director of the Montgomery County Collaboration Council, which serves as the local management board, obviously, in Montgomery County. Just talking about some successes briefly, as in terms of the work when it comes to our local management boards. We have one area of expertise, which happens to be our local care teams. And I won't read verbatim what you see on the slide before you here, but I think it's important to highlight that, you know, a local care team is an interagency council or committee of people designated to support our children and their families who are dealing with intensive and emotional and behavioral needs locally, right? This collaborative group of multidisciplinary experts comes together from several child-serving agencies within each jurisdiction to review a child's particular needs, and with input from the family, identifies potential programs and services to support that youth and family. Specifically in Montgomery County, we have representatives from DDA, HHS, MCPS, They come together to identify the needs of a young person and their family and can refer them to a whole slew of resources. That could be anything from wraparound to a wraparound provider that we have in Montgomery County to family navigation. It can also go to something along the lines of the local food bank. We get a lot of issues with people who are dealing with food insecurity and economic issues as well too, due to income volatility, right? So these are all issues that come before our local care teams that we try our best to address to make sure that our families have access to some level of resource before leaving our doors and going back out into the community. I think the slide deck working. Next slide. There we go. So the pandemic, obviously, we're only 4 years removed from it, but I think it's still ever present in the minds of many. So who stepped up during the pandemic? Local management boards did. We were a crucial partner within our respective jurisdictions to our local governments and CBOs and the community, most importantly, in ensuring that resources were being distributed and widely distributed, I should say, to those most in need. Those resources were items such as food and clothing, but also items like rental assistance, in connection to government, other government resources that residents may not have been as well connected to or informed of at the time. But as you can see here, the number of individuals served by our local management boards was a 150% increase from 212,000 to a little over 500,000 in comparison to normal service levels. Keeping in mind, while we are not direct service providers, we are a very strong and important conduit to those direct service providers. But in many ways, we, much like everyone else, pivoted and stepped up to the plate to make sure that our families within communities had access to those resources that they needed the most. This is just some highlights of some of the work that we do, again, specifically within our local jurisdictions, from working closely with the Governor's Office of Children around the Enough Act that is being rolled out right now as we are talking here today, to working as hubs within our specific communities around the work that's most important to us. Local control and decision-making is key here. What's happening in Anne Arundel may not be happening in Montgomery County. What's happening in Prince George's may not be happening in Baltimore County, so on and so forth. So having that level of nuance within each of our jurisdictions is so very important, because this is not a one-size-fits-all approach when it comes to any of the work that any of us do around the state. This is an older slide here, and I'd have to pop out of this to pop into another slide. But obviously, as you all can see, at the height of our budget back in 2005, we were a little over at $46 million. As it stands today, we're a little over $21 million, closer to 22. What we're talking about here is roughly a 52% reduction in funding for local management boards. And we know that there is not a reduction of need. Right. So the reflection of this here is not keeping pace with the need that we're seeing specifically within our communities. This past year, we did receive a supplemental to our budget of roughly, Pam, I believe, $750K. But again, that's to support the work that we're doing in our local jurisdictions related to the Enough Act with Governor Moore's Governor's Office of Children specifically. Without that supplemental of $750K, we'd be dropped closer to $20 million as a whole. Again, this is a huge slash from 2005, and we know that there is not a reduction in need whatsoever. We have not fully recovered from that level of 2005, obviously, but we still continue to do the work. So it's a testament to not only the importance that we hold within our local jurisdictions, but more importantly, to the commitment that we have to the communities we specifically work in. Pam, back over to you.
So our most recent success, and we do consider it a success, is that we hosted the first statewide childcare summit. And we did it in within and with the caucus, the Women's Caucus. And we were delighted to have their support for this. We work very closely with them. We do, all of us, believe that childcare is a woman's issue, and that is everything to do with how we look at childcare. So we and the caucus put together what was basically a 3-hour summit. We were amazed that we had over 300 attendees, and at the end of the 3 hours, we still had almost 250 of them. We had every county besides one. Our audience was very evenly distributed, interestingly enough. We even had some business people who I've always thought are self-interested in solving this problem. We had a whole load of feedback around childcare that we are now working on at a legislative level, not just with the Women's Caucus, but with the advocates, including the Childcare Association and Maryland Family Network, to try to build a legislative agenda, not necessarily based on a money ask, but how do we do this differently in Maryland so it's actually successful? So we have chased the bills from last year, those that passed and failed. We are recommending bringing a couple of them back this year. If we do not solve this in Maryland, we are never going to get to economic mobility. There have been so many surveys that have found that parents are choosing not to go back to work because they cannot afford childcare. So what is it that we need to do? And on top of that, of course, the childcare in Maryland is diminishing. And I know the comptroller, who was our keynote speaker, is bringing out a report on the importance of childcare in terms of the economy. And I think that's going to be really important for all of us. But the sorts of things that we heard was about not just the system, but the way we administer the system, the way we license the system, and the kinds of quality standards that we have put into the system that act as a barrier to childcare providers and to families. So we believe that everything we learned at that summit can be used now to build a childcare system that works. Next slide, please. I know you've all heard of the Enough Act. It was music to our ears. It's a very simple message. It's from the heart of Governor Moore. And it really is that we've all got to work together, focused in on the areas of need geographically.
Yeah, sorry about that. Looks like they might have muted everyone just now because we had someone speaking. But you go ahead.
Fine. I probably need to be muted. I take that. I take that very well. But get back to the Enough Act. It really is based on what we in Anne Arundel County call the geography and color of poverty. We know that in our county and across the state, the areas of the most need tend to be the areas that are disproportionately African American and to some extent Hispanic. That is everything to do with old policies of every kind that created a structural racism in our communities that we still see. So that notion of focusing down on the areas of most need, with the notion that if you put the resources there, your chances of actually decreasing the divide in income between the rich and the poor and really creating a much more economically viable state is really, really the way to do it. Obviously, the Enough Act is about bringing everyone together, households, unions, etc. And that's why it's called the Enough Act. And of course, local management boards have played a big role in this from the very beginning. And now we're also being asked to play a big role in a whole load of other projects, including the fiscal mapping project, which is about to be unleashed on the state, which will basically look at what we are spending county by county on children and families by mapping it. And local management boards are being asked to coordinate that at the local level. We're working very closely on Blueprint, especially around the area of Blueprint that we feel is not clearly defined, which is the 0 to 3, and to some extent the 0 to 5. We are being asked more and more to do needs assessment and asset mapping, not just around Enough, but around a lot of other initiatives like youth behavioral health. So that's really wonderful, and we want to do it, but we are funded at half what we were in 1990. Many local management boards have one person. Elijah and I are not in that position. It's far easier for us to move and really do this work properly at the local level. but something's got to give, guys. So we know that this is not the right year to be asking for money, given what we hear about the structural deficit, but we have to ask because we can't just keep doing more for less. In the end, you get to more for nothing. So we are making an ask this year. We will be meeting with the budget committees, and we're asking for 7 million for the entire state. And we will continue to make the pitch that you don't need to keep creating coordinating agencies at the local level. You've already got them, and we are ready and willing to do the work. We have been doing the work since 1990. And every time we see a new grant program, another state grant program that says we've got to create this coordinating agency at the local level, we're like, well, but why? You already have them. You created them back in 1990, and we're sitting here ready and willing to do the work. We just have to have the internal structure to do it. So you will be hearing a lot from us about that this year. And is that the last one, Elijah? I think it is, right? Yeah. So that's it for us, guys. Obviously, what we're looking at in the state now is a whole load of issues. We've got our own structural deficit. I think that we can probably expect some issues with our entitlement programs. They are all the things that are going to drive the work at the state level and the local level. I will tell you now that in my county and across the state, our working and lower middle class families, our moderate and lower income families cannot make it. They can't make it in Anne Arundel County. They can't make it in Montgomery County. Rents are astronomical. I talked to a family this morning, $2,300 for a one bedroom. Who can, I'd struggle to afford $2,300. That's more than most people's mortgage. Food, obviously, you know, is off the charts. Energy is crazy, and budget billing has created backlogs of bills that people owe, because as long as they keep paying their $150 a month, they are all right. As soon as they stop paying it, they owe all of the money that BG&E and others were storing up that runs into the thousands. So childcare, you either can't get it or it's so expensive you can't pay for it. I talk to families every day who have to give their children to a neighbor. The neighbor just has too many children, so she just puts kids in chairs and they watch the television. It is really bad out there. And so I don't want to depress you as you move into a legislative session that is going to be a lot about a structural deficit. But we have to do something about this terrible divide between what people earn and what they can pay for. We have over 200,000 people in our county, working people who cannot afford the basics on any given day. So I know you're the Joint Committee on Children, Youth and Families, and that's a lot to think about, but we have to all work on that together, because that is a reality. I am talking to families every day. I know I've gone off script, Elijah. I'm off script now. Sorry.
No, totally fine. Yeah.
Well, thank you so much. Elijah, you had anything else that you wanted to share?
No, just again, echoing Pam's comments, you know, we are looking to be the best partners that we can possibly be for you all at the local level. All we're asking for is consideration when it comes to a lot of the plans that are being made, legislation being passed, that you reach out to us, that you work with us. We work effectively, not only in our local jurisdictions, but we've worked effectively at the state level as well, too. That's evidenced by our partnership with GOC and other state agency partners, DJS, so on and so forth. So we're just asking that we continue to create dialogue with one another and opportunities for conversation as decisions are being made, as they impact our local communities and jurisdictions.
I appreciate that, Elijah. Appreciate that, Dr. Brown. Thank you so much for the work that you all do. Doesn't go unnoticed. We definitely appreciate the work, and we definitely thank you for putting this information together for us. so that we have the information, the data needed to make sound decisions. But I'll open it up for questions from anyone at this particular time. I see one so far, Delegate Henson.
Thank you, Mr. Chairman, and I apologize for my voice. I am recovering from something that's going around. Thank you, Dr. Brown, and thank you, Mr. Wheeler, for your presentations. Trying to drill down on what's driving the cost of childcare. We hear from our childcare providers that they have very slender budgets, and trying to make those budgets work are increasingly difficult. We hear about the high cost from families, and then we hear about the low wages from workers in the industry. I'm trying to figure out how those numbers jive and what's driving the high cost, and kind of if there's anything we're overlooking that we could make an impact on that would reduce those costs. But it's just hard to reconcile all those different factors, and I'm hoping you all can help us.
One of the things that drive costs, particularly in Maryland, is that we are an overly regulated industry. And so if you think about childcare as a private business, which is what it is not really a subsidized business. It is small, women-owned businesses trying to put everything together. The sorts of requirements in Maryland that come down to them from MSDE are incredibly difficult to manage, all the way from the Excel's quality standards system that effectively acts as a barrier to childcare providers receiving the grants they need to help subsidize the enormous cost, because the many bureaucratic requirements of Excel's makes it so hard for a center director with 3 staff who is probably also doing work in the classroom. And then the actual licensing standards that are higher than most areas, and the bureaucracy with which they are implemented is really, it's helping to make the situation difficult. There are lots of examples in other states about building flexibility in childcare in terms of all sorts of things like parent hubs and other things. All of those things are illegal in Maryland, and MSD uses that term, illegal. So we are not encouraging innovation. We are not encouraging small business. We are actually have made it about as difficult as we could possibly make it. So one of our recommendations actually has been to create a commission or something that will look at what we're doing as opposed to other states. Now, in terms of costs, other states have now figured out how to do some cost sharing. Some have built a 3-legged stool with business. One of the things we know is that business is self-interested in solving the childcare issue because they want to get everybody back to work. So I think it is an economic piece, and how do we use all the resources, including childcare provider resources, to build a system that is to some extent subsidized, but still works on this private business principle. So I think it's very complex. Parents say to me all the time, how can childcare providers be struggling? It's costing me an arm and a leg for my 2 kids. But it really is about the way we have structured it in Maryland. It is not about the providers. And what happens when you start trying to open this discussion is everybody starts screaming safety. But I've looked at this, and some of it is massively overdone. And when you start saying there's got to be 2 people, for every child, and you've got to have this piece here and that piece there, and this and this and this and this. Well, children are not safe who are in a neighbor's home, who are stuck in a chair, in a car seat, watching the television. So where's the happy medium that builds quality, but doesn't create this massive regulations that everybody is working so hard to manage? So we've done loads of research on this. We have got a bucket load of information. Unfortunately, it's highly detailed and highly bureaucratic, but we need somebody with power to look at this and say, we are really overdoing this in Maryland, and what can we do to increase flexibility for businesses so that they can actually make this work and reduce cost, which I think is what we could do. That was a long answer, Delegate.
but very thorough. Thank you, Dr. Brown. I
You're
appreciate it.
welcome.
Thank you, Mr. Chairman.
Appreciate your expertise there. Looks like co-chair Senator James has a question.
Yes, thank you. And thank you all for that really excellent presentation. And we need to hear it every year. And you're very thorough, and I really appreciate it. It looked to me, I had a couple of questions. One of your graphs looked to me like when the funding started at that higher 46 million, and then it plummets at various times. Some of it was around the time of the extraordinary 2008, 2009, economic crisis across the country. But I was curious as to whether maybe in the very beginning, with the very stated mandate to bring as many children home, if that was perhaps why you started at the level you did. But let me put a caveat on that, saying truly, from 90 to now, your budget shouldn't be smaller, no matter what your initial mandate was. So you could address that if you want. But what I really wanted to ask about were a couple of more detailed questions, which you can follow up with. First, if the research that you've done to show that the overregulation is basically being counterproductive. I heard you, Dr. Brown, say it's highly detailed, but I don't know if you could provide me, and I would say the whole committee, some shorter summary of it, because I'm very interested in the issue of government actually with the right intentions, of course, over-regulating in a number of areas, and then housing is another one, and costs go up. So is there a shorter document or a highlighted document that the committee could look at concerning the research you have on better ways to administer childcare in the state?
Absolutely. And Lisa can get that to you. We have that and we can get it to you. As to the original funding,
Yeah.
I don't think it was just about return diversion. They created us and then said, oh, well, wait a minute. We've created these bodies. Let's test them out. It was more of a, well, let's see what you can do. We've created the bodies in it. Now can you bring the kids back? And of course, we brought the kids back. But by the time the recession happened, it was all about what can we cut. And so we were one of the big cuts. It was actually Governor O'Malley's budget. We were one of the big cuts in Governor O'Malley's budget related to the recession and what he was going to cut. Right. But I don't think we weren't created to do return diversion. It really was this very sort of highfalutin, like, this system isn't working. We were part of systems reform. And this notion of different agencies dealing with families in different ways, this agency's looking at their education, this agency's looking if they get in trouble, this agency's looking at their health. Well, who's looking at the whole family? Right. And so this notion of, well, let's reform it. Let's make the children's cabinet talk to one another. They need to talk to one another. And then somebody had the bright idea of, well, if we're telling the state to talk to one another, we've got to make the locals talk to one another. Right. So that was really the ethos of it. How can we make reform? And then having done that, and I don't know who had the bright idea, but somebody on the children's cabinet said, let's test out the local management boards. Let's see if they can do, they called it return diversion. Right. And so that was the first initiative we ever worked on. That's very helpful.
And you also mentioned something I think is very important. And if you have any more information on it, this idea that when we oftentimes pass a bill or legislative or even regulation, we create a new council, a new board, a new something. And really that just is an inefficient way to run government. And you got to get everybody to be aware of it. So I heard you sort of speak to that a little bit, and not now, but if you have some information about where you think there is unnecessary duplication or where the local management boards could really, you're already in place, you have a long history, well respected. If you see places where you're like, I think this should be in our portfolio and avoids duplication of effort. I mean, I would be interested in that and totally support your request for $7 million more because you're being asked to do so many things. But if you see where there's duplication, you want to diplomatically touch on it and give us some follow-up, I'd be interested in that as well.
We would love to do that, Senator. Thank you for the opportunity.
Yes, and then just so I can understand this, when you were showing the fiscal mapping, the blueprint, the needs assessment, youth behavioral health, that slide, is it my understanding, was I understanding you correctly to say you all have been tasked with those, among others, those 4 things that you're involved in, all 4 of those?
Yep.
Yeah, and so again, that shows you've been asked to do more things, which you are well qualified to do, well positioned to do, but, without additional staffing and things like that. My last question is, I was very intrigued about, and you're so right, I'm a senator, I'm a lawyer, I'm all these things, and I still was on the front line for childcare in my family, right? It just
Right.
And there's a reason, but I'm not knocking the men at all, but we have a talent there, we have a skill there that is somewhat innate. And so, I'm not saying we shouldn't be very much in the forefront of it, but I agree with you. It is just the most daunting thing for a young family to cobble together childcare and to do it for, 12, 15, 18 years, depending how your children are. I was in that system for 18 years just because of my children's age. So you all mentioned how administering the system was one of the biggest obstacles. Now, that may be what you later talked about, the overregulation. But if there's more to that, and there's a little more to that summit, because I wasn't able to attend it, anything that you would like to share about that summit and the findings and the feedback, I would be interested in. Again, I would say I think the whole committee would be interested in seeing some synopsis of that summit.
We've got a great 3-pager that talks about the input. It's families, providers, and what's the third one, Lisa? We've got it. We have it. We have it all, and it's 3 pages, and it's really easy. So I know how busy you all are. I know you've got to do
follow up with you. Just finally, and in whatever you're going to provide us in anything I've just asked, I noticed you mentioned other states. So I'm assuming, but if not, please supplement the information. If there are states that you've seen that are doing this better, more efficiently, less barriers to access, would that be included? And if not, could you include some examples of states that we could look at and some highlights of what they're doing well that we ought to emulate?
So we have that. Lisa did the research on that, and she can get that to you.
Very good. Thank you, Delegate Harris. That's all my questions for now. Thank you very much. Great presentation. Truly appreciate it from all of you.
Thank you, Senator.
I appreciate that, Co-Chair. We actually looks like we have another question or comment from Senator Hedeman.
Thank you so much, Mr. Chair. Just a quick question. Can you explain to me what exactly your role is with regard to blueprint implementation? Thank you.
So I think all of us are at least part of our blueprint committee at the local level, but we generally tend to get pulled into whatever is happening next with blueprints. So an example of that is that it was found that MSD was not communicating particularly well around what they call push to pre-K. And push to pre-K is that notion that community providers should be doing the pre-K as well as the school system. And suddenly we were in legislation saying, well, local management boards need to figure out what the communication should be. So that's a perfect example of how suddenly, we're already part of Blueprint, we're already part of the local committees on Blueprint, but then we suddenly get a piece of it that is just legislated. And I can't remember which piece of legislation it's in, but then of course our local school system said, well, you're supposed to be doing this, which of course we will do, but it's another example of that. But we're all tracking Blueprint because you all know Blueprint is incredibly important, and we think it needs some tweaking. I think everybody thinks it needs some tweaking, and especially around the early years, but every pillar I think needs to be looked at in terms of what's in the pillar, how it was described, and then how it gets implemented. Because Blueprint itself is wonderful, but then it has to be operationalized. You've got to make it real. And I think it's in the real that local management boards have inserted themselves as best they could to really work with the school system, especially around the issues related to schools that are not necessarily part of the school system, but impact school level results. So we're working, all of us working extremely closely with community schools, figuring out, you know, how do community schools really be community schools? They can't just be organized by the school system. They don't know how to do it. They don't, because that's community is not what they do. So I think all local management boards are involved at that level. We're really trying to figure out what's happening with the concentration of poverty dollars. So there was a big load of dollars that was attached to Blueprint that was specifically around addressing poverty and the impact of poverty on opportunity and performance for children. But how are those dollars being spent? So I think it's things like that the local management boards are always looking across all of it. If we are going to increase opportunity, mobility, and decrease poverty for children, what are the things that can and should be happening in the community rather than the school system that will get them ready for school and then successful in school? And we all know, you know, that hungry children are not ready for school. You can't learn if you're hungry, and so on. So we're very involved in that piece of it, the sort of social drivers and how that should be implemented inside Blueprint. And I think every one of us are at the discussion levels of that and doing the best we can to advocate for taking a very holistic approach to Blueprint. Elijah, do you have anything to offer better than what I've said?
I think you've covered all the bases with it, Pam.
Thank you, Senator. Going back to our co-chair.
Yeah, I'm so glad Senator Hellman asked that question. And again, I don't want to make the meeting too long, but this was something I learned about a lot at in my own community, in my own county of Harford County, was this push to pre-K, aspirationally wonderful idea, but implementing it really a huge mismatch, if you will, between what the infrastructure was locally, and maybe worse, more challenging, was that so many qualified businesses, if you will, that could provide pre-K were just turned off by the over-regulation and obstacles. So we weren't getting the participation. So again, at a later time, if you could supplement the hearing, if you want to say anything right now, that's fine, but give us a little information on that you've been working on, because I know that is a huge issue in Harford County. And as I understand it, it's a huge issue across the state, that we have plenty of childcare providers, not enough, but many, maybe the vast majority, did not want to get into the integrated Blueprint system because of, again, a massive amounts of regulation and requirements. So Dr. Brown, if you want to speak to that briefly, but if you also have written information that you could follow up, I would be interested, and I'm sure the whole committee would be.
Well, we created a subcommittee of our task force just around push to pre-K because we were so angry about it. Yeah. Like the best provider in our county of childcare almost walked away because it was so difficult first to apply, then to get any communication, and then this whole notion of making small businesses pay up front for slots they don't even know they have. Yeah. So we have got a whole load of stuff on that, Senator James, but that should not be as it is. There was a way to create the 50-50 that we wanted, and it has been the way it has been implemented in all of it, from the grants that were written, the way it was scored, the lack of communication after the grant was given, the rigidity around funding, the dollars up front. And we have just had one of our really good providers walk away and refuse to apply this year. She just won't apply for it. She said, I can't do it. It costs me too much money.
Yes. And so I think your insight there's going to be very, very helpful. So appreciate it. One last thing you can, again, supplement later. We see that what your budget is, it's not enough. But you also have this capacity, you being all the boards, to apply for grants. And I have no sense of how successful each local management board is in getting grants that are out. So if you could, again, in writing, let me know. Yeah, of course, I'm interested in Hartford County, but I'm interested statewide because you all work together and you're more powerful together. So getting a sense of what the successes are in getting grants and where the challenges are to add to your $22 million budget, hopefully $29 million budget. I'd be interested in that. And if you could share that with the committee.
So those of us who are bigger, the bigger local management boards
Yeah.
have a better chance of that. So I'll use my local management board. We bring in money at 8 times what the state gives us. They give us 1 million, we get 8 million, right?
Right.
Across the state, when we add it all up, it's $3 for every dollar. The smaller ones don't have the same capacity to chase grants, so they do less. The bigger ones, like me and Elijah, we get more. But if you add it all together, the dollars are 3 to 1. And every time you increase our capacity, you increase the opportunities for us to double that money and treble that money. And in our case, 8 times the money.
Right, because then you're compounding a smaller jurisdiction's problem when they're so tiny, maybe one person, you don't have a grant writer, and there are dollars that are being missed by that community, not by the fault of anybody, but the way we've structured things and the way we're funding you. So anyway, I'd be interested in that. Thank you.
That's absolutely what you've just said. Absolutely correct.
Right.
The 3/4 of the person in Somerset County that really needs the resources does not have any infrastructure to build them.
I'm sorry to keep going on, but there something my father created when he was state treasurer was called the Local Government Investment Pool. It was a brilliant idea where little jurisdictions, little towns who could not afford to hire their own fiscal consultant and the like, and invest the money and to create pension systems and other things. They pooled their resources and then joined in a state effort. And I was just wondering, this is another topic, and for another time, but the idea that you all could perhaps come up with a pooling of assistance between the smaller and the larger. Again, I don't think we should make it as an unfunded mandate for you all, but if there is capacity to assist a smaller jurisdiction, if the money's there, that Anne Arundel could say, yeah, we're going in for a grant, but we're going to include Dorchester County, and we have that ability to do that. So this is just a thought about, thinking out of the box and creatively. I don't know if you've ever looked at them.
And the shore does that a lot. That's a real behavior down on the shore. So Queen Anne's will apply and they'll include their mid shore, and then the ones at the bottom, they'll do it as the lower shore.
Okay.
And we've done it at times as the South region. So when we can do that, we do that. It's not always easy across granting sources,
it's not.
But we do it when we can.
Very good. Thank you, Delegate Harris.
Appreciate it. Thank you, Chair James. We have Madam Chair, Nessa Atterbury.
Thank you, Mr. Chair, and thank you for the presentation today. This is more of just a comment, actually, on the pre-K piece in terms of the public and private partnership. And I just wanted to remind folks that we did in the House significant work, or I should say in the entire General Assembly. We did significant work on House Bill 1441 last session that passed because we heard in Ways and Means from the private childcare providers that were having extreme difficulty coming on board with the locals. And I think everyone in the committee across the board and on appropriations, we worked closely with the propes on this issue. And so just, circle back when you have a chance. I mean, we extended funding for some programs. We modified the waiver process. We created a career ladder and staff qualifications. We tried to create a hub providing economic support, grant writing support, and the like. We did a lot of things. We said counties can actually lease space to try to find space. And certainly, since that has passed, I've still heard from providers in terms of just other practical things. I think it was already mentioned, Ms. Brown mentioned when funds get released and like these little just kind of nuances that I think we're going to have to continue to work on that hopefully won't have to be legislated. But I think 1441 was a huge step in the right direction on getting our private providers on board locally so that we can get all of our little people in pre-K. Just a comment. Thank you, Mr. Chair.
We loved 1441 and we supported it and we were delighted when it passed. I guess what happens, Chair Atterbury, is then it goes to implementation. And so we're still waiting to see what happens from that. So for instance, we can't find the hubs. If there's any hubs anywhere, we don't know where they are. And so I could talk about that for a long time. I'm not going to, but the legislation that has been passed around childcare is really, really good, but it still has to go through this process through a large state bureaucracy down to the local level to get implemented, and something happens in that process. And so we don't see the changes coming quickly enough. And maybe that's just the reality of all legislation. But in this particular case, it feels so urgent and it takes so long.
Well, we appreciate that, Dr. Brown. Thank you, Madam Chair Atterbury, on that comment. Is very informative information that I think we all needed a reminder of. Any other questions from anyone? All righty. Any closing remarks, Madam Co-Chair?
No, I think I asked lots of questions and took up too much time to begin with. So thank you very much for helping make this a very good meeting.
No, we appreciate you. We thank you so much. We thank the team and everyone that took time out their schedule to be here. We don't take that for granted. So thank you for taking the time out your schedule to be here with us as one team and one Maryland. So we greatly appreciate you all. I think that'd be it. Any other questions, thoughts, concerns before we hang up? Any last rounds? We good? All right. Appreciate you all. Thank you so much. Have a great rest of your week. Have a great holiday as well.
It was a pleasure. Thank you very much, everyone.
Bye-bye.